This is Emily Jones, and I'm going to discuss the disparity faced by rural women in accessing obstetric care. Between 2005 and 2014, a U.S.-based study showed 179 rural counties lost hospital-based obstetric services, and access for rural women was becoming increasingly scarce. Citing concerns with staffing, reimbursement, and low birth volumes, small rural hospitals are choosing to no longer provide obstetric services. Numbers of providers of obstetric care in the rural setting have been low historically, but the numbers are decreasing rapidly. In 2008, only 6.4% of OBGYNs practiced in a rural setting. From 2004 to 2014, the percentage of rural counties with a practicing OBGYN dropped from 55% to 46%. Family doctors have provided as much as 100% of obstetric care in some rural areas, but that number is decreasing. Within 1 year of the closure of rural obstetric units, outcome changes can be appreciated in the number of births outside the hospital, the number of births in hospitals with no obstetric units, and the rate of low prenatal care. Efforts are being made to attract providers to rural areas. The Improving Access to Maternity Care Act was made federal law in December 2018. It challenges the Health Resources and Services Administration with identifying high-needs areas and creates a loan forgiveness program for providers in these areas. The scope of practice of advanced practice nurses varies from state to state. Scope of practice regulations that limit the scope of practice for APRNs also limit the number of providers available for prenatal care. Rural women with limited access to prenatal care may benefit from removing restrictions. Accessing medical care in a rural setting is more difficult than most areas of healthcare. Less than 50% of women who live in a rural area live less than a 30-minute drive from the closest hospital, which offers obstetric care. They face longer travel distances for dental care, specialists, mental health, and other medical services. Rural women are less likely to participate in any type of health screenings or preventative health measures than their urban peers. Women who live in rural areas are more likely than their urban peers to be impoverished, to be uninsured, and to have Medicaid or Medicare. Rural women cite financial burden as one reason they do not seek health care, and adding the financial strain of traveling longer distances does not make that burden easier. Making use of telemedicine can allow women to seek local care without the added expense of traveling, while maintaining a connection with a provider who can deliver her child. One study found the most commonly reported cause of closing an obstetric unit in hospital was staffing issues. It is difficult to recruit and retain nurses and providers in low-volume hospitals. Cross-training staff to work in other care areas can relieve the stress of nurses losing hours due to low birthing volumes. Policies which allow for student loan forgiveness for providers of obstetric care in rural areas are aimed at drawing physicians to high-need areas. Family physicians can be trained to ensure they are able to provide adequate care in rural areas without obstetricians. Advanced practice nurses can provide prenatal care, and midwives can deliver babies if state regulations will allow. Low patient volume and low reimbursement are financial issues which cannot be ignored. If birth volumes are too low, the providers who would practice in that setting will not see enough patients yearly to maintain their competencies. When these providers are faced with an obstetric emergency, there is a fear they will not have the experience necessary to handle the situation. A suggested solution is that providers from smaller facilities can share call duties with larger regional medical centers. Rural hospital obstetric units are shutting down throughout the United States. As hospital OB units close, the providers most often leave with them, and the area has no providers of obstetric care. Legislation which entices physicians to practice in rural areas should be supported. APRN should also be encouraged to practice to the extent of their scope of practice to provide prenatal care for women in need in rural areas.